your local news leader. This is Meet Your Neighbor.
All right, I'm here with Dr. Marc Saad, an electrophysiologist. Is that right?
That's
All right,
right.
from Cardiovascular Institute of the South. Good afternoon. Thanks for joining us.
Thank you for having me.
So, what is an electrophysiologist?
So, electrophysiologist, otherwise known as an EP, as what people hear that, is a physician that initially got trained in cardiology, and then we go on to do additional training in heart rhythm disorders. So we know how to diagnose and treat all the heart rhythm abnormalities.
Yeah.
Actually, an analogy that I give to patients is, so a cardiologist is like a general contractor for your heart. Interventional cardiologist is a plumber, and EP or electrophysiologist is like the heart electrician.
Oh, okay. All right, that makes sense.
Yeah.
So, what kind of heart rhythm disorders are there? Are there many?
There are. You can have variations. So you can have slow heart rates, you can have fast heart rates, and then you can have heart rates that are, the timing is the normal timing, but it's irregular, and people are pretty symptomatic from that.
Okay.
A lot of heart rhythm disorders that people hear about are atrial fibrillation is pretty common, probably one of the most common. And then life-threatening ones are like ventricular tachycardia or ventricular fibrillation.
And what are some symptoms that people need to watch out for?
So when they have slow heart rates, they can feel pretty fatigued, tired, don't have any energy to do anything. People that have the fast heart rate problems, they'll feel palpitations, they'll feel pounding in their chest or in their neck. They may have some lightheadedness, and then worst of all, people may have they may pass out or have sudden cardiac arrest.
Should they go to an emergency room? Should they call
So
you
I mean,
guys?
if you just feel a little bit worn out or tired, then yeah, you should see if you get an appointment with a cardiologist or electrophysiologist. If you're feeling like you're passed out, or if you are passing out, then I'd say go to the emergency room.
What kind of treatments do you guys do for that?
For the slow heart rates, if you're on medicines that could be backed off of, we try doing that. Otherwise, if you can't back off it or you're not on any medicines that cause it, we put in pacemakers, which allow us to control the heart rates. For the fast heart rate problems, we can do what's called an EP study, where we diagnose what the rhythm is and then try to do what's called an ablation and try to get rid of the problem.
Mm-hmm. And this can affect people from all ages.
Mm-hmm. Yep. So
Wow.
there's pediatric electrophysiologists, and then there's adult electrophysiologists as well. So it's a broad spectrum. Slow and fast heart rates go for everybody.
Yeah,
So,
no kidding. So where can people find more information about your practice and if they have questions?
So we're Cardiovascular Institute of the South. You can go to www.cardio.com.
Okay, great.
Okay.
Well, thank you so much
Okay.
for joining us. We appreciate it.
Okay, thank you.
All right,
Thanks for
Mark,
having me.
meet your neighbor when we come back.